Hello, my name is Jose Enrique Arauz, and I will talk about infection prosthetic definition. Prosthetic is an inflammation of the lining of the rectum. The rectum is a muscle tube that is connecting to the end of your colon. Prosthetic can cause rectum pain and the continuous sensitive that you need to blood movement.
Proctitis. Proctitis, inflammation of the rectum. Proctitis may be due to a considerable number of causes, including infectious agents and ulcerative colitis. Infectious proctitis is often due to agents such as Chlamydia trachomatis, Neisseria gonorrhoeae, and herpes simplex virus, all of which can be acquired during anoreceptive intercourse. Proctitis is also a hallmark of ulcerative colitis, in which case it may be accompanied by intermittent rectal bleeding, crampy abdominal pain, and diarrhea. Proctitis. Proctitis.
Case of proctitis. Proctitis has many cases, but sexually transmitted infections are the most common. Gonorrhea, syphilis, herpes and anal warts, and chlamydia are the most common case of sexually transmitted proctitis. It is more common in homosexual men and in people engaged in oral anal with many partners. Autoimmune diseases of the colon such as Crohn's disease and colitis, non-sexually transmitted infection.
In this video, I'm going to explain to you what proctitis is in under 2 minutes. Let's go. Hi, my name is Mike, the Heal Your Gut Guy. I healed myself 100% naturally of Crohn's with a perianal fistula, so I also suffered from a little bit of proctitis. And here's a picture of what my butt used to look like. So proctitis is when the last 6 inches of your rectum become inflamed and irritated. Symptoms vary greatly from pain defecating, blood, pussy discharge, and it can be very embarrassing and in an uncomfortable condition. GI doctors and drug companies claim to not know the cause of what is, causing proctitis, but you know what? They induce this stuff on rats just about every single day so they can test out their expensive drugs. I want you to hit that subscribe button, hit that notification bell, because we come out with natural gut healing videos at least 2 to 3 times a week. So what is the definition of proctitis? An inflamed and irritated rectum area. Now, what is inflammation? Inflammation is your body's response to injury in an attempt to heal. Wounds, pain, and irritation are all a sign that you have injured something. Proctitis is just an injured rectum. If your rectum is constantly inflamed, if this area is constantly inflamed, then you are doing something on a regular basis to hurt this body part. Proctitis is just an injured rectum. It is that plain and simple. So what I want you to do is post a comment about what your struggles with proctitis are, and we'll get to you in the comments. And the best comment gets a copy of our ebook, 21 Nutrition and Health Lies Keeping You Sick. And now there's only 5 things that can injure the gut overall, the whole gut. And I want to share that with you, so I highly suggest you click the I in the top corner here or in the description, and we have a video called The 5 Causes of Gut Inflammation. We are doing something right here. This is just like any other injured body part. We are doing something to hurt this body part, and it becomes infected and will never heal. Just imagine a cut on your arm getting infected. If we don't treat it with natural antifungals and help it heal, it will never heal, especially in this region, which has a reputation for being pretty gross. So, all right, guys, I want to help you guys get better. Thank you, and I'll talk to you later. Bye.
Pros and contras in the therapy. Pros: in patients with proctitis or colitis with mild to moderate activity, topical treatment with mesalazine is considered a first-line treatment. Both the inside remissions and front maintained it. Cons: abdominal pain, diarrhea, flatulence, nausea, and vomitings, headache, dizziness, chest pain, difficult breathing, or swimming in the lift due to a effect on your heart. Issue applied in Ecuador. The problem with these dishes is that in the Ecuador there is not large study relation to these dishes, but several studies indicate that the male to female ratio in crumbs dishes is the 1.08 at 1, and in colitis is 1.1 at 1. In conclusion, given the similarity in clinical presentation, endoscopic and histological findings between infections, prosthetic and inflammatory lung disease, we emphasize the importance of a clinical history that includes sexual risk behavior and present tricks that might suggest different diagnosis to avoid delays in diagnosis, broad hospital stays, unusual tests, and erroneous treatment with untold consequences.
The main symptoms of inflammatory bowel disease are diarrhea. This is often associated with blood, pus and mucus. Patients can get cramping abdominal pain. This is around the time they open their bowels. They can feel generally tired and unwell. This could be due to the disease being active, possibly as a side effect of the medication, or just simply waking up in the middle of the night on a regular basis to go to the toilet. They may lose their appetite and have weight loss. This could be because they're not eating enough or not absorbing enough nutrients from their food because of inflammation in the bowel. They can just generally feel unwell, feel feverish. They may develop anemia, especially if they are going to the toilet and having lots of bleeding. And occasionally some patients may develop painful tiny ulcers in the mouth called aphthous ulcers. And inflammatory bowel disease can also affect other parts of the body. It can cause arthritis, especially in the joints in the arms, legs and back. It can cause rashes, something called erythema nodosum and pyoderma gangrenosum. And it can also affect your eyes. A very common condition called episcleritis can occur, which is when the outer lining of the eye becomes inflamed, red and painful. There are certain recognized risk factors for inflammatory bowel disease. Living in a Western society is a risk factor. This could be due to lifestyle choices such as diet, possibly environmental pollution. However, recently there has been an increase in incidence of inflammatory bowel disease, especially in Asia, again possibly related to lifestyle changes such as diet. Being young is a risk factor. However, there is also increased incidence of inflammatory bowel disease towards later stages of life. People don't know exactly why this is. Having a family history of inflammatory bowel disease significantly increases the risk of you developing the condition. Smoking affects ulcerative colitis and Crohn's disease differently. It is a significant risk factor of Crohn's disease and makes the symptoms much worse. However, it is very protective for ulcerative colitis, and ex-smokers are more likely to develop the condition. Certain gut infections are thought to trigger inflammatory bowel disease, such as Campylobacter, Salmonella, and E. coli. It is thought that having your appendix taken out is protective against developing ulcerative colitis. It is thought due to a change in the immune system, but people don't know exactly why this happens. There are a range of drugs that are used to treat inflammatory bowel disease. Initially, the treatment is given to heal the inflammation and to bring about remission so that the patient feels better. Following this, the doctor will keep the treatment going so that you don't get any more flare-ups and the disease is under control. This is called maintenance treatment. Obviously, lifestyle choices will also help as well, such as drinking a lot of fluid, especially if you're having lots of fecal loss, avoiding trigger foods and stressful situations. If you have nutritional deficiencies, then you may need some supplementation, such as vitamin D, iron supplementation if you're anemic. So this is the mainstay of medical treatment. Occasionally, when patients have really bad disease, such as they develop stricture and Crohn's disease, then they may need surgery. The genetic causes of inflammatory bowel disease can be prevented. However, by making lifestyle choices, you can reduce the risk of developing inflammatory bowel disease and also reduce the chance of relapse. This can be done by eating healthily, exercising regularly, and if you've got Crohn's disease, then by stopping smoking. There is no strict individualized plan that patients must follow. However, there are basic principles that will help improve symptoms, especially during a flare, such as having smaller meals, having them more frequently, eating in a nice relaxed atmosphere, avoiding insoluble fiber such as bran, vegetable, fruits, etc., and avoiding greasy foods, and avoiding trigger foods. Obviously, this can vary between individual to individual. It is also important to increase the amount of fluid intake, especially water. Try to avoid drinks that contain caffeine, because caffeine is a stimulant and it can rev up the bowel and make the diarrhea worse.
Thank